Welcome to The Point of View. This is your favorite current affairs show here on ChannelOne television. 25 days to election 2024, and as the election draws closer, The Point of View takes a closer look at one of the top 5 issues that voters say will affect their voting. I'm sure you've been following, whether for Afrobarometer or from the NCC survey. Health has always been an important topic. Tonight, we look at the pledge or the promises by the key parties in respect of the health sector with the question, which party has the best plan for your health? We'll show you some interesting promises and interview the key spokespersons on that sector when we come back. Stay with us. Welcome back. So tonight, The Point of View takes a closer look at the health manifestos of the leading political parties, particularly because health has been a big issue this week. The Vice President and flag bearer of the NPP, Dr. Mahmoud Mawumia, has promised to make the treatment of dialysis free. Indeed, they did pilot it in the country, and from the 1st of December, for patients who are under the NHIS, dialysis treatment to be free. It was piloted for people above a certain age and below a certain age. It's generated some discussion as to whether this is sustainable or just a political gimmick. The NDC flag bearer has also been in the Hafubono areas, commissioning a health project with his wife, and also promised some things around health. So before I even show you what they've both been saying, let me just look briefly at some highlights of the manifestos when it comes to health. Then later on, I'll speak to Dr. Titus Bayo, who is one of the NDC arrowheads on the health sector, and Dr. Ezekiel Obing-Ajekum from the NPP and the Bawumia team. So let's start with the NDC. They have quite a number of interesting headlines around the health sector. Preventing diseases and promoting health and wellness is the first major theme. Under that, you have almost 10 different promises. Introduce things like Food for Health initiative to educate the public on the health and nutritional benefits of indigenous Ghanaian foods. Implement a new vector control program and promote sustainable sanitation practice in collaboration with assemblies, the private sector, and the Ghana Malaria Program towards eradicating malaria. Still under the rubric of preventing disease and promoting health, there are things around collaborating with research institutions to increase surveillance and monitoring of health data. They also want to provide periodic data on water, soil, and air quality for safety of citizens, supporting development of infrastructure and spaces such as community parks to facilitate physical activity and foster a fitness culture among citizens, scale up regular screening of cervical, prostate, and breast cancer, and encourage self-screening, among others. Now, other subheadings in the NDC Manifesto on Health include increasing access to mental health care, and they have about 6 promises there. Then there's something on herbal, traditional, and alternative medicine development. That has about 5 key promises, including reviewing the Ghana Health Service and Teacher Hospitals Act, promoting local and international partnership among herbal medicine research, and investment in modern science methods, technological innovation, etc. Then there's public health emergency and pandemic preparedness. That has about 2 key bullet points. Localizing quality primary and specialized health services. That has quite a number of promises, including strengthening the CHIPS compounds, upgrading school sick bays, reintroducing the Onuado and Onipenua mobile medical and dental services, prioritizing completion of remaining CHIPS compounds. Key promise, making primary health care free and universally accessible to Ghanaians in CHIPS compounds, health entries, health centers, and clinics. Very big one. We'll discuss that during the interview segment. Then there's also providing information on available medical services to clients, developing a regulatory framework to allow interested pharmaceutical outlets to attach licensed clinics. Then there's the health worker motivation for quality health care. So this could have been under human resource, but this is under the health sector. Lots of promises there. They are talking about rewarding healthcare workers who accept postings to rural communities, expanding access to nursing training, reintroducing and regulating vehicle tax waiver scheme to health professionals, scholarship opportunities to at least 200 nursing tutors to pursue PhD level education, and then introduce risk exposure insurance. So a lot on health care workers. Still within the health sector, another subheading for the NDC, sustainable funding for health service. A lot of promises there. Establish the Ghana Medical Care Trust Fund, decollateralize the National Health Insurance Levy to ensure that the total revenue accrued to NHIS is set aside for only health-related purposes, introduce a fund rotational system at CHIPS level, remove taxes and tariffs on vaccines and medical donations. A lot of promises. Still on the NDC, strengthening health service delivery systems with a whole raft of promises under that, almost 20. All right, then there's the pharmaceutical sector development, and then repositioning Ghana as a medical tourism hub, and then expanding healthcare delivery infrastructure. NDC has been big on infrastructure. The NPP is approach to the health sector is also quite interesting. So they have the subheading health administration, and that they have leadership and governance, where they will deepen public-private partnerships for healthcare delivery and management, encourage PPP placement of key equipment such as diagnostic and imaging systems, and establishment of medical centers of excellence. Then there's healthcare delivery and pandemic preparedness. So this is quite similar to the NDC, the pandemic point, where they have almost 7 or 8 different promises. Availability of all hours, quality healthcare provision at primary level, scaling up of network of practice, including modal health centers, complete ongoing Agenda 111 to ensure that all districts have hospitals, complete all regional hospitals and Agenda 111 to serve as specialist referral centers for all new regions without regional hospitals, complete maternity and children blocks at Konfanoche and Kolebu, in addition to ongoing subspecialist facilities, and then establish new subspecialist centers in teaching hospitals, create a friendly environment for breastfeeding mothers by ensuring that hospitals, workplaces, and other public places have rooms for breastfeeding to improve child survival, collaborate with GES to ensure availability of functional sick bays, and conclude the tissue and organ donation storage. So all of this is under healthcare delivery and pandemic preparedness. Then there's another subheading on healthcare services, ensuring the appropriate legal regime and policy guidelines for establishment of home care. So we are talking about nursing homes and rehabilitation services, including caregiver support provisions. There's a whole thing on medical tourism as well, similar to NDC. Then there's blood services delivery, which is quite interesting. The Ghana Blood Service do not have a center in all the regions. The number of voluntary non-remunerated blood donors is very low. So they'll construct blood centers in all regions that do not have one. They'll abolish blood processing fees and place blood centers on a common digitized platform to ensure equitable distribution of blood and blood products in the country. Then there's the very famous drone delivery service that Dr. Bame has been talking about. That's also there, in addition to the existing 6 additional, 2 additional sites will be established to cover Upper West and Savannah at Funsi and Kintampo. So this is still in relation to drone delivery. There's a promise around the National Ambulance Service, establish a regulatory body for ambulance services, include ambulance service reimbursement in the NHIA benefits package, very interesting, and then strengthen accident and emergency centers across the country through the modal health centers. Those are the highlights of the 2 leading political parties when it comes to health. I'm going to show you briefly what the leading candidates have been saying about health. I'll start with Dr. Bawumia. He's been talking about the free dialysis that was introduced a month ago, which is going to be revamped. Let's hear from him. Later on, hear from John Mahama as well. He's also been talking about the health sector. So let's just take a quick view.
For the kidney problems, into here dialysis. Dialysis no so sikano doso. Nipa bebre into me and to yasa sikano. Into 6 months ago, you started pilot. Say you the dialysis no beba National Health Insurance. So nipa na umuye over 60, any under 18. For the last 6 months, Umuji dialysis under National Health Insurance free. So, pilot no, the pilot no, every year from December 1st this year, from December 1st, all kidney dialysis patients, Umubeji and the National Health Insurance free for kidney dialysis from December 1st.
It can now cater to mothers and their newborns in a more modern and dignified environment. Nananom, ladies and gentlemen, the timing of this inauguration could not be more opportune. Health statistics continue to reflect a rising demand for maternity and neonatal services nationwide. And as we just heard, we are doing about 300 deaths for every 100,000 live births. That is a figure we've tried to push down for many years, and it's because of the lack of facilities like this that makes it difficult for us to achieve our targets. While we celebrate this inauguration, we cannot ignore the broader challenges confronting Ghana's health system and the urgent need for transformative reforms. Many Ghanaians can still not access the medical care they need, sometimes not because healthcare facilities don't exist, but because the costs are often beyond their reach. For this reason, among others, the next NDC government, which God willing I will lead, will prioritize critical social interventions designed to make healthcare more accessible and affordable for every Ghanaian.
So you saw the two leading candidates mention aspects of health. So as I say, this week has been very heavy on health, which is why we decided to focus on health on the program. So as I also said, for almost all the surveys, whether it's NCC, Afrobarometer, or even Global Info Analytics, health has featured in the top 5, together with job creation, infrastructure, the economy, and education. So health is a very important topic for Ghanaians. So let me welcome my guest. I have Dr. Ezekiel Obeng, or Ejekum Obeng, who is a key member of the manifesto team on health. Doc, good evening. Thanks for joining us.
Good evening, Mr. Able.
Wonderful. I need to say he's with the New Patriotic Party, NPP. Then we have Professor Titus Bayu, who is a key member of the NDC Mahama Health Manifesto Committee. Prof, good evening. Thanks for joining us.
Good evening, and thank you for having me.
So let me start with Dr. Ejekum Obeng. What is the overriding thrust of the NPP and Dr. Bawumia's health manifesto?
What underlines our policy on health is, first of all, the continuation to achieving universal health coverage, 2, primary health care, and 3, digitalization and IT within the health space, and of course, making sure that as many as possible Ghanaian health workers who have gone through normal, successful training have the best of jobs to do and live quite a comfortable life within the space of Ghana. And the overarching effect is that the Ghanaian has accessibility to healthcare, one that will not put strain on his or her pocket, and one that is proactive, healthcare that is proactive to giving the Ghanaian the opportunity to improve the health-seeking behavior of the Ghanaian for quite a healthy population that would be part of the bold solutions to deliver a resounding economy for the country.
So universal healthcare, primary healthcare, digitalization, and all of this with an emphasis to accessibility and affordability. So that's my summary of what you've said. Prof. Bayu, NDC Mahama, what is the main thrust of the health manifesto?
Yeah, good evening once again. I would say that the vision of His Excellency John Dramani Mahama, as expressed in our health manifesto, is to ensure that we have quality health care for all, by all, and in all. And the overarching aim is to ensure that quality health care is closer to the people towards attainment of the universal health coverage and towards attaining the health SDGs. And one of the main thrusts of this is to fully localize health care in Ghana so that the country attains health independence, and also ensure that healthcare is very accessible to the citizenry. And all this is hinged on the pillars of making healthcare very equitable to everybody and accessible, and manage the resources of healthcare well in a very sustainable manner.
So I notice you're making reference to outcomes more than outputs, because generally when you look in the manifestos, we see a lot of specific outputs. So CHIPS compounds, this type of hospital, but I noticed that you are focusing on the effect of that. Is this a deliberate,
Yes.
Emphasis?
Yes, it is deliberate, because the principle is that all those outputs eventually should lead us to the outcome that we are looking for. So people sometimes focus on the hard issues, but what is those leading us to? And that is where our focus is. So we wish that the viewer appreciates that our health infrastructure policy, our health human resource policy, our healthcare financing policy, our health worker motivation policy, all of these is aimed at setting deliverables. And those are the ones that I'm trying to emphasize on.
All right, now let me come back to Dr. Agyemang Obeng. I noticed that in your manifesto on health, you actually list the achievements in terms of infrastructure of this current administration. And you even go back to list Kufuor era achievements. Of course, I don't see any of the NDC achievements in your manifesto. Why this approach of adding what has been done to what you want to do?
Well, we are a party in government, and we seek for re-election. We just wanted to take the opportunity in our manifesto to tell the Ghanaian that over the past 7.5 years to 8 years, this is what we've achieved. Facilities that have been started and completed by this current administration were all listed for the Ghanaian to be able to verify. We know media houses like yours will definitely do fact checking. So we took pains to list all the facilities that we have built across the country. I mean, in our manifesto, we went back to inherited projects as far back as NPP 1 under President Kufuor, those that were started and were abandoned within the 8 years of the NDC. And we came back to completing them. Those that the NDC themselves even started and couldn't complete, we've completed them. And the rest that we have started and are yet to be completed, I mean, we just listed all of them there. We just wanted to give the Ghanaian evidence-based manifesto so that we build a foundation and dovetail it into what we propose to the Ghanaian, so that it gives easy reading and understanding of what we seek to achieve. So we just wanted to reflect on the past, tell you what we've done, the hard aspects of health. Various policies we've introduced here and there were not listed, except the infrastructure base of our healthcare delivery that we took pains to list all of them. And to tell you that, yes, we still are battling with the opponents, inherit projects and abandon them within 8 years without completion. For President Kufuor to have secured funds for 9 hospitals, and for 8 good years, those facilities were not completed. If the Ghanaian is able to make a choice between the NPP and NDC, with all the massive infrastructural projects we've started vis-a-vis Agenda 111, we are telling Ghanaians that if you give us the opportunity to continue, then your best bet is with the NPP to be able to continue to making sure that every region and district within the country has some form of hospital facility. If you leave it in the hands of the NDC, just as they did with President Kufuor's Eurojet project, they will not be able to complete the Agenda 111 we've started across the country. So that was the motivation, Bernard.
Well, Professor Bayu, I noticed you also talk about finishing projects and infrastructure projects as well. What's your response to what Dr. Agyemang is talking about, abandonment of projects and the rest of it?
Yeah, so it's interesting, Bernard. I think this is an intellectual discourse we are having with discerning viewers, and we ought to be factual. But the summary of it is that what they have done in their manifesto demonstrates what we will call selective amnesia where you deliberately decide to forget some things and remember some other things. And when you populate your manifesto with a full list of infrastructure things that you have done, I mean, if NDC wanted to do that, our manifesto document will be so bulky that no one can have. Is there any gainsaying that all the universities in this country that train healthcare workers were established under the NDC? Is there gainsaying that the College of Health Sciences, the dental schools, and all those that are existent now, if they were not in colonial times, were started by the NDC? We didn't find all that necessary. We wanted to commit to the people that we are willing to complete ongoing projects, and we have demonstrated that severally. And let me just draw your viewers to the fact that the assertion my junior colleague is making is not factual and is baseless. And if anybody is going to use that to make a decision, they should be apprised with the actual fact. He is making reference to the Eurojet hospitals. These Eurojet hospitals indeed was started, the idea concept during the President Kufuor's era. But the part that again, they always demonstrate this selective amnesia and decide to forget is that when the financing model was achieved, the Arab Spring came. When the Arab Spring came, the funding fell through. You could not access those funding again. It took a visionary government under the Mills Mahama administration to go back and find new source of funding to start this project. And the records are available. The Egyptian company that was leading it stated it when the work resumed, that indeed the Arab Spring affected their source of funding, and therefore they could not start. And it had to take the ingenuity, creativity, and will I say purposefulness of the Mills Mahama administration to be able to finance this for the project to restart. And so if you would cite Eurojet Project 9 abandoned hospitals and say that they were left, that is very unfortunate. And he would then forget that when they came back, these hospitals had progressed and some were even completed. An example is the Upper West Regional Hospital. Then the military hospitals that were at various levels. So they cannot claim credit for that. Somebody had to tactfully get new funding options for this to continue. But the NDC has a solid manifesto and did not find it necessary, like I mentioned, to be listing things that have been done in the past. But if you want us to go in that direction, I have a full list to give you.
All right.
But if you have a solid policy like our primary health care policy, free primary health care policy, which is a game changer, which is increasing access to over 60% of the Ghanaian population that is located in rural areas, where data showed us that 23% of persons living in rural communities did not have their NHI card working, and that 45% of Chiefs Compound were not even accredited to provide the NHI services. So if you have such a setting and you are a social democratic party seeking to govern this country, mindful of all these facts and wanting to ensure equitable access to healthcare, your best bet is to make healthcare at this level free. Okay. And we've done proper costing of this, and we know that it's achievable.
We will take a short break. When we come back, we'll look at specific initiatives of the main parties and see which one rings better with our viewers. This is the point of view. Tonight, we're examining more closely the health manifestos of the leading parties. Professor Titus Bayo is from the NDC. Dr. Ezekiel Ejekumo is from the NPP. Stay with us. Welcome back. The point of view tonight is looking at the health sector, and we're examining manifesto and policy approaches of NDC NPP, Professor Titus Bayo, NDC, Dr. Ezekiel Ejekumo of the NPP. Doc Ejekumo, let me come back to you. I noticed the uniqueness of your manifesto in relation to drones. I think that while there are a number of things that cut across, like the medical tourism that both of you want to do. Both of you talk about infrastructure and NHIS. I think the drone policy is pretty unique with the NPP. I notice you want to expand it. Can you comment a bit about that? And also, the dialysis controversy that we've had for the past few months, you've not even waited for the manifesto you've not even waited for the election to come. You've already started it. Some people see that as opportunistic. So talk a bit about the drones and the dialysis for me.
A quick one, just 10 seconds. My senior colleague clearly didn't prove me wrong. The fact that you had 8 good years and you had 9 hospitals to complete. You spent 8 good years and you couldn't even complete a single one of them. The earliest any of them was commissioned was 2019. So clearly the NDC has proven that if we leave Agenda 111 for them, if simple ratio and proportion is anything to go by, for 8 good years, they couldn't complete a single of those zero-jet projects. How many years would they use to complete Agenda 111? On the back of the drone medical services, it forms part of emergency healthcare delivery. And you can't talk of emergency healthcare delivery without making available emergency or essential medicines, including blood and blood products. And that was the idea behind the drone services. So far, we have about 6 drone centers across the country, catering for almost about 3,000 health facilities across the country. We are left with just a few parts of the country to cover. And that's what we promised, that we would have 2 additional stations up north and then the Nkranza area, to making sure that we have 8 centers that would cover the entirety of the country. So it's not just about drone delivering medicines. The idea is to improve emergency healthcare, and part of it is the ambulance services we introduced. Before we came to power, President Kufuor in 2004 had started the ambulance service, and due to the mismanagement by the NDC government, at the time the NDC was exiting nationwide, we had just about 37 functional ambulances. And if you did any computation and any sharing of such ambulances across the country with the 10 initial regions we had, each country had less than 4 ambulances. So as part of emergency healthcare delivery, we were really lacking as a country. So the idea of making sure that aside the provision of facilities, we need to making sure that our emergency healthcare delivery is well catered for. It's the idea that birthed the 307 ambulances that was commissioned within the first term of this administration, and the drone services. And clearly, we've seen the benefits. The drones have delivered over 17 million blood and blood products, essential medicines, including vaccines to rural areas. The dialysis issue, we've had a lot of conversations around it, and let's at this point say a big thank you to media houses like yours who added their voices to the discussion from somewhere last year, September. We've had this discussion back and forth, and the government gave a roadmap that for starters, let's pilot an idea where we seek to assist the people living with a condition. So to start with, we said that anyone within the age of retirement would have free dialysis sessions, and anyone within the ages of non-employability, so to speak, would also have dialysis being done for free. And those within the working ages would have theirs subsidized. And that's what the government started with. So within the 6 months, we were piloting the idea, reviewing the books, doing the calculations, doing the estimates, how many people are living with the conditions. You go back to about 10 years, how many people were having the conditions, and then you do an estimation as to the coming years, how many people, with all things being equal, under normal temperature and pressure, as you say, under science, how many people are we envisaging to have the condition, and what are the remittances to the National Health Insurance Scheme, and whether or not it's feasible to cater completely for all persons living with a condition. And we did our studies within the 6 months period. This stakeholder engagement spoke to all persons and stakeholders within the healthcare system, and we saw the feasibility, and we are able to do it. Proper management of the NHIS, the funds coming in proper allocation to the authority. We should be able to cover the condition. It has nothing to do with election or electoral gimmick. It's purely a data-driven exercise that we did, and we'll be able to do that.
All right, thank you. Now, Prof, my substantive question would be to elaborate on the primary healthcare free. That's pretty serious. Under localizing quality primary and specialized health, you promise to make primary health care free and universally accessible to all Ghanaians. That's a pretty big promise to make. And the question would be whether you've considered the cost. But I know you would like to react possibly to the point around the dialysis and maybe the issue he raises about the hospital. So maybe let's do that quickly. And then tell us how you hope to make primary health care free.
All right. Bernard, it's surprising how my colleague would always want to go in this tangent. So he's telling me that the Upper West Regional Hospital, which I cited, Bekwai, and the other hospitals that they came when we had virtually finished and just commissioned, they were able to build them from scratch. NDC did nothing, and they were able to do them that when they came to power in 2017, by 2019, they were ready for commissioning. And yet, their promise to complete the Agenda 111 hospitals in 18 months has never seen the light of day. That till date, they've not been able to commission a single one of them. I am sitting 5 minutes from an Agenda 111 facility. The contractor, everybody has abandoned site. So what is the creativity here? But I'll leave that. And when he talks about ambulances and the drones being part of an emergency concept, as a medical doctor, I will be the first to admit that emergency care in this country is substandard, and we need it. It's critical. But he should be honest with the truth. When you inherit a government and you abandoned over 56 ambulances packed in the sun on the allegation that they were substandard, which you were later proven wrong, you probably took people to court and could never justify anything. You didn't even give opportunity for the remedial measures that were put in place to be implemented. And that's the famous Japa case. So is he not aware of it? Doesn't he live in this country? Anyway, I leave it for all of us, our judgment, which is the superior policy that they've brought. Ambulances that they've brought, that the service contract of the ambulance can buy many more ambulances, that you create a Ponzi company to service these ambulances, that the people are using ambulance service staff, yet are being paid hugely for servicing these ambulances. I, Professor Bayo here, had to provide tires for the ambulance in Lambuse because it was grounded for months. Is that a service we are talking of? And the drone system, Bernard, just for the sake of our viewers, if we will pay as much as we are paying for these drones to fly anti-snake venom, to fly medications that we can procure by our normal procurement systems, it means there's a failure of our procurement system. And it's one of the big deceptions of this country. When they started the narrative of the drones, they said they were never going to use any government money. Corporate individuals were going to donate. Now, they are spending heavily from the government purse. Question is that the best use of our money? When you fly medications that can be procured through a normal procurement system on a take or pay contract, is that what we think of? But I'll leave it there. Now, let me focus on our primary healthcare policy. Bernard, I think they claim they have something on primary healthcare, but if you look at our primary healthcare policy, it's a superior one. Why do I say so? The free aspect of this primary healthcare policy has been well thought through. I've given you the basis of it, that less than 23% of persons living in rural communities had a valid NHIS card at the time we did a survey. Less than 45% of CHIS compound were accredited to provide NHIS services. Now, to remove the membership bottleneck, and what's the thinking behind it? Bernard, you and I know that the major funding to the NHIA is the levy, not the premium, which means that every Ghanaian contributes to that levy. Over 90% of the funds of the NHIA is from the levy. So if everyone is contributing, why should the absence of the card limit people from the most basic form of care? This is the thinking behind which His Excellency says no. As a people, we should be fair to everybody. Every Ghanaian who is contributing to the NHIA levy should enjoy a certain minimum package of services. And that's why we are starting with the Chiefs compound. At the Chiefs compound, we have done the cost estimates. We assume that we would have about 6 functional Chiefs compound. Currently, we have 6,000. Currently, we have about just 4,000 functional Chiefs compound. And that's another thing. Under this government, the Chiefs compound have contracted. Functional Chiefs compound we handed over were over 4,000. They brought it down to just around 4,000. Now, we estimated that we are going to complete abandoned Chiefs compound, and that can take the figure to about 6,000. The average cost per annum per Chiefs compound, looking at the kind of services they offer, is no more than 57,000 cedis. So when we do that, it takes us to just about 345 million Ghana cedis to provide this type of care at that level in our phase 1. In phase 2, where we seek to go to the level B and C, we have gone through the costing of it and realized that if you add the health centers, level B and C facilities, the cost there is a little high. Each facility may spend about 266,000 Ghana cedis, 400, approximately. We have 1,650 of these facilities. That will cost us about some 439 million Ghana cedis. In all, when we implement these 2 phases, it's going to cost us just roughly about $49 million per annum. How are we going to finance it? We are going to reverse one of the cardinal sins that the NPP has caused this nation, and that is capping the NHIS. We have promised that the next Mahama administration will uncap the NHIS. The NHIS fund in 2023 was estimated at 5 billion Ghana cedis. Right? If we uncap that and we make it available and release 20% of the NHIS, it can finance this thing that I'm talking of. So this has been well thought through, and we know that we can do it, and we can offer this important care that guarantees universal access to some minimum basic package to everybody. And remember, primary healthcare is not only the treatment or curative part, it includes preventive services, it includes food, health education, and all this has been factored into it. So nothing the NDC say is in vacuum. And for the discerning Ghanaian listening, I can tell you that the people that say and do what they say is the NDC. We have a government that when we promise to uncap the NHIS, they also say they will uncap the NHIL. They've had several budget opportunities and never uncapped it. So how do we believe that when they come, they will uncap it?
All right.
We'll leave it to the thinking of the Ghanaian.
I'll take a final break. When I come back, we'll take NPP's response to NHIA and then finally look at health workers, the issue of retention versus getting them to go abroad to provide service for which we can get some national revenue. This is the point of view. It's a focus on health for manifestos as election 2024 approaches. Stay with us. Welcome back. Point of view tonight is focused on health, and my guests are Professor Titus Bayu of the NDC, Dr. Ezekiel Ejekumabeng of the NPP. Dr. Ejekumabeng, I want your comment on NHIA. I look at the manifesto, I see amending the NHIA Act to establish a separate health insurance regulatory body, making available medical equipment, medicines, and other consumables, and ensuring that health institutions receive the NHIS payments promptly. Can you deal with the capping issue that he raises, and then tell me what else you want to do there?
I mean, it's a known fact that some aspects of the money is, I mean, looking at various governments from time immemorial, even when NHI started from President Kufuor's era, we've never had an administration where total disbursement to the NHI has been 100%. Clearly, in terms of percentages, yes, you can argue that for percentage-wise, the government is not currently doing as much. But of course, even with a reduction in how much, in terms of percentages, in terms of nominal values, how much money is released to the NHI, this government has done more than any other government has done. But of course, in terms of percentage, clearly you can speak of the capping and decapping issues. But the NDC is running away from the NHIS because they have bad record with the NHIS. They inherited a scheme that had an active membership of 12.5 million Ghanaians in 2009. They inherited a scheme that had active members of 12.5 million Ghanaians. With all that Probeyo is saying that the NPP has capped the NHIS, they will decap NHIS and whatnot. Their record with NHIS is abysmal, to say the least. You inherited a scheme with active membership of 12.5 million Ghanaians, and for 8 good years, you couldn't even maintain the numbers. By the time the NPP government was returning to office in 2017, the active membership of the NHIS had dwindled to 10.6 million Ghanaians. Clearly, there's an Al Jazeera documentary on the state of the NHIS and our healthcare delivery online. Everyone can Google and look at it. The cash and carry system was brought back under the NDC and President Mahama. We look at the issues of facilities turning away NHI card bearers for the fact that the government was not releasing monies to pay them. The facilities were in arrears. The NHI was in arrears for about close to a year. They're not paying the facilities. So clearly, they don't have any superior record when it comes to the NHIS. They don't have any superior record. In fact, they collapsed the scheme. And in fact, the participation, or in terms of confidence by those who patronize the NHIS, is there to tell the story. On the issue of the primary health care, I thought they were going to make different allocation in terms of budget allocation to cater for what my senior colleague says is going to be free for all. And the stages, they are starting with coaching compounds, they will graduate to clinics, health centers, and district hospitals, all within 4 years. Don't forget, the NDC promised the good people of Ghana one-time NHIS premium payment, one-time payment. Never materialized. So clearly, they don't have any superior record when it comes to health.
Let me take your view. Let me take your view finally on the point around exodus of health workers. I think there was a point when President Akufo-Addo wanted to sort of discuss some remuneration for the country when we export nurses. Some people think that the exodus is too much. We shouldn't even be thinking about that. We should keep our best people here. What does the manifesto say about retention versus exporting health professionals?
Yeah, so it's all about making sure that the healthcare worker has reasons to stay in the country. What I said, their working conditions. Are there facilities available for them to work? Are there motivation when they start working? And of course, looking back, the NPP started with a few under President Kufuor. Unfortunately, once again, under the same administration that collapsed the national ambulance system, under the same administration that collapsed the NHIS, they cancelled all the freebies and the motivations the government through President Kufuor gave the health worker. Don't forget, President Kufuor had introduced the waiver system for health workers, especially doctors and nurses, to import cars to a certain mileage into the country. President Mahama came and cancelled it. The nursing training allowance, he cancelled it. It took the NPP administration under Nana Dankwa Akufo-Addo to reintroduce the nursing training allowance, and work is, in progress to introduce the car waiver once again for the healthcare worker. And of course, we have also promised that all other cadres of health would have the opportunity to import cars freely into the country, and we will extend the free education at the specialist level. This government has made it easier for any doctor who seeks to specialize in the country. Hitherto, you pay for your fees within a year to be able to have your education to become a specialist. This government has extended free education to specialist training, and the government seeks to continue the free education for doctors who are seeking to become specialists and to train freely in the country. We are going to extend it to our nurses and other cadres of health. So it's all about motivation and what the government is going to do to help the healthcare worker to be able to find some living and comfort within the country. And comparing the records of those governments, those that came to cancel what had been started and those that came to reinstate what President Kufuor started, the records are there for the healthcare worker to choose which of the parties has their best interest.
Let me give the last word to Professor Bayu on the exodus of health workers and how you intend to manage that, to monetize it or to stop it. Prof.
Right, thank you very much. I just have to put just in a second that a lot of the issues Doc mentioned at the NHIA are debatable. The nominal figures must always be based on temporal relation, at what population, at what depreciation. If he wants, he should compare the figures he's mentioning now in cedis, in dollar terms, and compare the two tenure, and then he will realize that he will bow his head in shame. Brain drain has definitely become worse under this government and has taken a different dimension, Bernard. And our government is in waiting, is mindful of this. We are mindful of this because if you check, brain drain earlier was in pursuit of higher academic qualifications. People wanted to go and specialize and didn't have the opportunities. And the Ghana College was an example. It stemmed the tide a little. Currently, the people exiting this country as health workers are our most experienced specialists, consultants, higher level, very qualified staff are the ones leaving. Definitely not for school. The reason is this. People have lost hope in the country. There's a state of hopelessness and despondency. I am telling you that a change in government alone will restore some confidence in people who want to stay. That's a change in government from NPP to NDC, restoring some confidence in our economy, which will lead to people wanting to stay. That's the first point. Our government intends to introduce an ethical migration policy. An ethical migration policy where people who leave this country will live under a plan system with the WHO and our partner countries. And the country will be compensated for these people leaving. You cannot prevent people from leaving. Restore confidence in your economy, let the people wish to stay, but it will be difficult for Ghana to pay as much as any other the developed economies are paying. But if that confidence the people want to stay, but those who wish to go, the country should be compensated in a way, and we can deliberately export doctors and nurses in a controlled manner so that the country will benefit. We also have a motivation package to help our health workers feel comfortable and want to stay here. We are promising to ensure equitable distribution of healthcare workers to all parts of this country. We are giving 20% of their basic salary as an allowance for agreeing to work in the rural areas. We are giving them promotion out of term. We are giving them earlier study leave. And these can motivate people to want to stay, not only stay, but agree to serve in a rural community like my constituency, Lambuse, so that people can stay in this country and work. But let me just quickly add that when he talked about the role of the Ghana College and what they have done, and then the NDC cancelled vehicle waiver, he's being disingenuous. When we canceled vehicle waiver, what did we introduce? We introduced a revolving fund, which the health workers at the time thought was even better than the waiver, because then government bought the vehicle for you directly, brand new vehicles, and then from a fund, and people pay gradually from their salaries, rather than finding money to go and buy a second-hand car, struggle to import it, and then get some waiver. But we have seen that, yes, we are assembling vehicles here, we will introduce it, and we'll manage both. Thank you.
We'll leave
Bernard.
it. Yes, Doc, you wanted a quick one?
Can my senior colleague tell us how many doctors had a so-called revolving fund purchasing vehicles for them? It's clearly not the case. They cancelled the car waiver. They don't have any superior.
All right,
they don't have any superior record. They don't have any superior record in terms of motivation. You cancel training allowances. You cancel. We introduced free education.
All right, gentlemen, this is
clearly
not.
The NDC does not have and the health worker knows this.
This is not really necessary. I'm sure the doctors and nurses and the lab scientists watching know for themselves. So we'll just leave it here. Thank you for talking to us. We have your manifesto highlights attached to this program. Viewers can see and decide for themselves what they believe. But I want to thank Professor Titus Bayo, who is a parliamentary candidate as well for Lambusi Kani and the spokesperson on the Manifesto for Health for NDC, and then Dr. Ezekiel Obinga-Jekum from the NPP, a medical doctor himself, also a key member of the Baumia Health Manifesto team. Thank you, gentlemen. I wish you good luck. It's 24 days to elections. May the best idea win. Have a good evening.